Tirunelveli, a prosperous district in Tamil Nadu, is known for its paddy produce and for having the most wind power units in the state. A short distance away are villages of the Arunthiyar community, a community that has been facing caste-based discriminations for generations, which has now trickled down to its children as well. Most men from this community work as scavengers or coolies, while the women roll beedies all day to earn a living. Earning just enough for the day, providing a happy and healthy childhood for their children was a distant dream. Now, this dream is slowly turning into a reality. Vignesh from Chokkampatti is a happy and healthy 3-year-old child who is fast picking up his beautiful mother tongue while enjoying a regular childhood. It's hard to believe until a few years ago, he was identified as one of the many weak and malnourished children from his village.
The doctors in the hospitals would not even check our children properly or give us good medicines.
The children of this community are victims of discrimination from a very young age. As babies, they are prevented from accessing quality health services. A study reveals that 94.8% of the children from these communities are malnourished, and there are gaps in the implementation of their healthcare policies.
We did not have a doctor for delivery at the PHC, and we had to travel 6 kilometers on bad roads in labor. 2 women from here had miscarriages on their way to the hospital.
Children in the Anganwadi were made to sleep without mats. In case they defecated, they were sent back home for cleaning. There is one sub-center close to our village, but the doctor comes only 2 or 3 times a week.
Children in this area are prone to diseases like fevers, chickenpox, diarrhea and others because they are malnourished. Also, there is poor sanitation and lack of clean drinking water. The government health centers lack quality doctors, nurses and medicines. Rampant discriminatory practices only add to the health issues.
Over the years, the HREPC team, led by its founder, Mr. Bharathan, a well-respected child rights champion in Tamil Nadu, and volunteers from each village, have relentlessly worked to bring about lasting change in the lives of Dalit children. By concentrating their efforts towards monitoring the effective functioning of health centers and schools, implementing immunization drives, monitoring nutrition levels of pregnant mothers.
My son was only 2 kgs when he was born, and now after the HREPC team has spoken to the doctors, he is getting proper care. He is out of malnutrition and healthy.
என் பேர் தங்கம் நான் தென்காசி வட்டார பொறுப்பாளராக பணி செய்கிறேன் இப்போ அங்கன்வாடியை பார்த்தீங்கன்னா
We engage with the teachers at schools and Anganwadis. We also engage with health workers and other government officials at the Gram Sabha and Panchayat. We regularly discuss the issues faced by children in these communities. We want the primary health centers and schools to be strengthened so our children can access proper health care and quality education they are entitled to from the government.
Support our endeavor to help children realize their dreams.